Well, it's no secret that a woman's body changes dramatically during pregnancy, and some of the changes are subtle, like an increased respiratory rate, while other changes are more obvious, like the baby bump. But what about pregnancy symptoms that are unexpected? Bridget is standing by now to ask a doctor.
Well, more and more women are opening up about some of the strange pregnancy symptoms on social media, even making it a TikTok trend right now. Joining us this morning to talk more about, some of the side effects and symptoms that go along with pregnancy and postpartum, Dr. Cielo Gnecco, an OBGYN with Winnie Palmer. And we're just so happy to have you here this morning.
I'm happy to be here.
We make light of it on social media. I know lots of people have been, making these TikTok videos about, the baby hair that sort of, recedes and grows back during, postpartum, and some of the skin changes and facial feature changes. So can you highlight some of those for us? Because sometimes people are surprised and they probably come in saying, is this normal?
Absolutely. So we tend to blame everything on hormones, right? The swelling, skin changes, people tend to start seeing these little spots on their skin, hair growing in areas where it didn't grow before. And more recently, there's been talks about your pregnancy nose, right? So it's just, lots of changes that eventually everything will go back to normal.
And everyone's different too, right? So sometimes you might have one pregnancy be different than the other in the very same patient, correct?
Yeah, every pregnancy is different. I have patients tell me that, patients that have been pregnant 4 or 6 times, every single pregnancy has been different. I don't even know what to expect anymore.
Right.
So lots of changes that we do have to go through when we're pregnant.
What are some of the more unexpected ones, or maybe, more rare that you still see come in?
So skin changes tend to be a huge part of pregnancy. So patients do tend to see this, what we call melasma, so dark spots on your cheeks. I do tell patients wear your sunscreen because sun exposure will make everything more marked on their face. Swelling is also a big one. Patients do tend to swell everywhere, in their feet. Your shoes don't fit anymore. Your hands even get numb during pregnancy. And also your nose tends to be bigger, and it is a real thing. So that is mostly because of hormonal changes in your body.
Yes, and you'll also notice sometimes your senses change as well.
Yeah, absolutely.
Talk to us about why that happens.
Excuse me, what changes?
Your senses.
Absolutely. So one of them is, your sense of smell and your sense of taste. And interestingly enough, there's not a lot of studies as far as why that happens, but we do know that is your body's protective mechanism to protect your baby. So women tend to create certain aversions to food or certain drinks, and it might be towards food that might be harmful to your baby. So it's basically trying to protect your baby. We do have taste buds, and they are responsive to hormones as well. And as hormones increase, those tastes also increase. Patients do tend to feel a metallic taste in their mouth as well. And these things do tend to get better after the first trimester.
Can you tell us more about what happens to your body in the postpartum stages as well? Because you're never the same after a pregnancy. I mean, you bring a life into the world, but your life is also altered.
Absolutely, and I think this comes with a lot of the changes that are physical and also emotional. Postpartum depression is very common, and it's also because we're tired, we're not sleeping, and we're taking care of this little newborn. So it can take a huge toll on you. So all the things like swelling and skin changes and weight do tend to get better, but a lot of these emotional changes tend to persist. But for the most part, they do get better. But women do go through a lot of changes that can take a huge toll on them. So I always remind my patients, take care of yourself. I know you're taking care of this new little one that's new at home, but also focus on yourself. Make sure you go out for walks, you exercise, you eat healthy, stay active, and stay hydrated.
Are there any extra supplements you can do afterward in that postpartum period as well? Because you're depleted, you're really depleted from growing a human.
Yeah, so I do advise patients to continue taking the prenatal vitamin. I know there's some postnatal vitamins out there, but they're very similar. And just maintaining a healthy diet, staying very well hydrated, and staying active as well. So I think that's one of the most important things. And keep taking your prenatal.
Yes, and if you're feeling, like you said, some, feelings of depression or anxiety, talk to your doctor, right?
Absolutely. We have so many things that we can do for you as far as advice, meditation, exercising, also medications that we can start you on because it can be a very difficult transition. And we want to make sure that you're healthy and able to take care of your little one.
Right, because it's not just about taking care of the baby. Mama
Absolutely.
needs to be taken care of too.
Absolutely.
Well, thank
Absolutely.
you so
You're
much
very
for coming in,
welcome.
Dr. Gnecco. We appreciate you.
Absolutely. My pleasure.